Is a needle biopsy less invasive than surgery for lung cancer? Imagine needing a sample of lung tissue to figure out if you have cancer. You might wonder which method is easier on your body. A needle biopsy is generally considered less invasive than surgery for diagnosing lung cancer. It involves inserting a thin needle through the skin and chest wall to collect tissue. Usually, this is done under local anesthesia, so you stay awake but numb in the area. Because it does not requiring large cuts or opening the chest, it causes less pain and has fewer risks. Recovery is quicker, often just a few days, and you can usually go home the same day or after a short hospital stay. There are two main types of needle biopsies for lung cancer. Fine needle aspiration uses a very thin needle to draw cells from the lung nodule. Core needle biopsy uses a slightly thicker needle to remove a small cylinder of tissue. These procedures are often guided by imaging techniques like CT scans or ultrasound, which help doctors target the exact spot. This guidance improves accuracy and reduces the chance of needing a second procedure. Because needle biopsies are minimally invasive, they are often outpatient procedures, meaning you can go home the same day. Patients typically experience minimal discomfort and recovery is quick, allowing them to return to normal activities sooner. However, needle biopsies do have some limitations. The tissue samples are smaller, which can sometimes make it harder for pathologists to make a definitive diagnosis. If the results are inconclusive, a surgical biopsy might be needed later. Surgical biopsies involve making an incision to remove a larger piece of tissue or even the entire lesion. These procedures are more invasive, requiring general anesthesia and longer recovery times. They also carry higher risks of complications like pain, infection, or bleeding. When it comes to treatment planning, surgical biopsies can provide more detailed information because of the larger tissue sample. Sometimes, especially in early-stage lung cancer, removing the entire tumor during surgery can also help improve long-term outcomes. But for initial diagnosis, needle biopsies are often the first step because they are safer and less disruptive. They help doctors decide whether surgery, chemotherapy, or other treatments are needed. In summary, needle biopsies are less invasive than surgery for diagnosing lung cancer. They offer a safer, quicker way to get important information with fewer risks. But in some cases, surgery may still be necessary to get enough tissue for a complete diagnosis or staging. Always discuss your options with your healthcare team to choose the best approach for your specific situation. Remember, every patient is different, and your doctor can help guide you to the most appropriate procedure based on your health and the location of the lung lesion.